talk about what foods to eat and what to avoid if you're having any kind of kidney diseases. Now, each kidney contains multiple functional units which are called nephrons. Kidneys are more than just filters. They not only eliminate toxins and waste from our body, but they also regulate a lot of things. They eliminate toxins like urea, ammonia, uric acid, creatine, electrolytes, and lots of water. They also regulate the pH of our body, the acid-base balance. 99% of the water gets reabsorbed. The electrolytes get reabsorbed. This plays a very important role in regulating the blood pressure. Kidneys also play a very important role in RBC production. That's red blood corpuscles. It also helps to convert the active form of vitamin D, D3, apart from liver. You know that our heart pumps 5 liters of blood every day, and out of that 20 to 25% goes to kidneys. Kidneys play a very important role in purifying our blood and getting rid of toxins. Now, what happens if you start to get a lot of diseases of kidneys? So what are different type of kidney diseases? Glomerular nephritis, which means inflammation of nephrons. Nephrotic syndrome, acute and chronic kidney diseases, which is basically damage of our kidney cells, nephrons. Renal stones, which are kidney stones. What are the causes of kidney diseases? You know, the number one cause of kidney diseases are diabetes, chronic blood pressure, certain medication, drugs, autoimmune diseases, inflammatory diseases, toxins which are present in the environment like lead, mercury, pesticides, fungicides, herbicides, alcohol, smoking, non-steroid anti-inflammatory drugs. What are the symptoms of chronic kidney diseases? Like I've said earlier, kidney filters toxins out of our body. So whenever there is any kind of kidney damage, this leads to build-up of nitrogenous waste in our body. Because since they cannot get eliminated, this starts to build up in the body. This results in high level of nitrogenous waste in our body. Hypernatremia, that means increase in amount of sodium. Hyperphosphatemia, high amount of phosphorus in our body. Hyperkalemia, high amount of potassium in our body. So whenever there is a lot of nitrogenous waste which has been built up, this leads to loss of appetite, fatigue, loss of sleep, insomnia, blood in the urine, foamy urine, which means there is loss of protein in the urine. Specifically in nephrotic syndrome, there is a condition which is known as albuminuria. There is loss of albumin, which is protein in the urine. Puffy eyes, edema because of water retention. Muscle cramps because of imbalance of electrolytes and minerals. Now, there are a lot of dietary restrictions when it comes to kidney diseases. You cannot eat whatever and how much ever of food you want because the kidneys are not being able to remove toxins from our body. So the first restriction comes to protein. We know protein is great for our health. I always recommend my clients to eat at least 1.5 to 2 grams of protein per kg of body weight. But when it comes down to kidney diseases, there is protein restriction. The requirement of protein becomes 0.5 grams per kg of body weight. This is because of buildup of nitrogenous waste in our body. We do not want to load the kidneys with lot of nitrogenous waste. But even if there is restriction in protein, it is always better to have good quality of protein. We know that there is restriction in phosphorus. Because of high level of phosphorus in our blood, we need to have proteins which are low in phosphorus. Now, a lot of proteins are a good source of phosphorus. So we cannot restrict everything. But we have to focus on proteins that are low in phosphorus. We need to limit the amount of phosphorus we have to eat in our diet. You can have some amount of lean pieces of chicken, codfish, sea bass, low-fat cottage cheese, shiitake mushrooms. So these food groups are comparatively less in phosphorus as compared to other protein items. We have to focus on a diet that is low in potassium, low in phosphorus, low in sodium. Lot of fruits and vegetables contain lots of potassium in them. Green leafy vegetables, generally fruits, legumes, everything contain a lot of potassium in them. So we cannot restrict everything. Now there is something which is known as leaching of potassium. How we can do that? We need to wash the vegetables thoroughly. Always peel off the outer layer of the vegetables, cut them into small pieces and again wash them thoroughly. I always generally tell my clients it's always better to wash the vegetables first and then cut them, because we want to retain the minerals and vitamins which is present in the vegetables. But in case of kidney disease patients, it is the opposite. We need to leach out the excess amount of minerals and potassium. So this is how we can do it. Cut the vegetables into small pieces, wash them thoroughly, soak them in warm water for at least 2 to 3 hours and then discard of the water. You can also boil the vegetables and then discard of the water. This helps in removing the excess potassium which is present in vegetables. Certain vegetables are low in potassium: cabbage, cauliflower, sulfur-rich vegetables like garlic, onion, radishes, asparagus, celery, lettuce. Now these vegetables remove the toxins from the body and they try to reduce the uric acid levels as well. But like I said, you have to thoroughly wash them, soak them in warm water if possible. Whole grain cereals, pulses are a great source of phosphorus. So we need to avoid them whenever we are having any kind of kidney problems. You can have some amount of white rice, buckwheat, bulgur wheat, which are comparatively low in phosphorus as compared to whole grain cereals. We need to consume a diet which is low in sodium. Avoid processed foods, junk foods, processed meats, canned meats, sauces, pickles, fruit juices, sodas, even dairy, cheese, because cheese, sodas, dairy, junk and processed foods contains high amount of phosphorus and sodium in them, and there's a lot of restriction when it comes to kidney patients. So we need to avoid these kind of foods in our diet. You can use substitute of dairy like using plant-based milk options, which are comparatively low in phosphorus and sodium. We need to have diet which is low in oxalates, because we want to avoid any kind of possibility of forming kidney stones because of high level of oxalates found in these foods like spinach, beet greens, kale, all your dark green leafy vegetables, chocolate, nuts, seeds, legumes, grains, black tea. Now black tea also contains tannins, and legumes, grains, they contain lectins. Ideally, we don't give restrictions to normal people, but people who are having problems of kidney needs to avoid food containing lectins and tannins because they are toxins, and we want to reduce any kind of toxins for such patients. We don't want to load the kidneys and cause any more harm. So have a diet which contains low of lectins, low of tannins, low in oxalates. Also, there's uric acid buildup. So high levels of uric acid can also result in the forming of uric acid stones. So if that is a possibility, you need to have diet which is low in foods that are rich in purines, such as red meat, organ meats, shellfish, alcohol. Now there are certain foods that are great for the kidneys, like spirulina. It is an algae which contains a lot of vitamins, minerals, phytonutrients. It contains chlorophyll. It has a lot of benefits. It removes toxins from our body. It also helps to cure anemia, which is very common in kidney patients. Like I said earlier, kidneys play a very important role in RBC production. So if the kidneys are not working well, chances of anemia are very high. So spirulina is a good choice. Apart from that, spirulina also reduces edema in the body, which is also one of the symptoms of kidney patients. Include extra virgin olive oil. It is a very good source of vitamin E. It is anti-inflammatory in nature and contains a lot of antioxidants. It also contains low amount of phosphorus. Vitamin D. We need to take vitamin E supplements because kidneys play a very important role apart from liver to convert the active form of vitamin D. So whenever there is a problem in kidneys, the active form of vitamin D gets difficult to convert. So always it's better if you are taking supplements of vitamin D. You need to have a low salt diet. Apart from avoiding processed and junk foods which contain a lot of sodium, you also need to add very less salt in your diet. because salt contains sodium. You can also consume low sodium salts, which are easily available. Include fermented foods in your diet. They're a good source of probiotics. You can also take probiotic supplements. And lastly, there's always restriction of water because of edema. So try to reduce your water intake. Now all these restrictions depends upon what stage of kidney disease are you on. The more serious your kidney problem is, there are going to be more restrictions. So you have to consult your doctor to ask what kind of restrictions are allowed. But these points are going to be of great help. I'll be posting more videos related to nutrition and health. This is Menka Vision signing off. Thank you.